Welcome to the Med Spa Method. I'm Leslie Schweitzer, and I'm a doctorate-prepared nurse anesthetist. In 2022, I got into aesthetics, and I opened a medical spa called Lush Aesthetic Bar. I've changed the name a couple of times, and it's now called Lush Aesthetics and Wellness. Now I'm making this podcast to share with you the things that are going on inside the medical spas. I want to share with you the treatments that work and don't work, skincare that works or doesn't work, and I want to bring forward some of the issues, some of the treatments that you don't know about, and I just want to guide you so that you can choose a provider that's right for you, a medical spa that's right for you, the treatments that are right for you, because it's your face and it's your results and it's your safety, your health, your wallet. I want you to feel empowered to choose what's right for you. If I told you that there are some treatments that would dramatically improve your skin, your health, your confidence, the aging process, and that these treatments cost less than many popular aesthetic procedures, would you believe me? Today on the Med Spa Method, we are talking about the most underrated treatments inside the med spa. Everybody talks about Botox and filler, and I often say even Botox is what gets people in the door. It's like a household name. Everybody knows what we're talking about when we're talking about Botox, but inside the medical spa, we actually have 4 really big services that don't get enough attention that actually deliver wonderful results. Some of them without needles, most of them without needles, and wonderful results, and they even cost less than your year's worth of Botox. So let's get into it. In my opinion, the most underrated treatments within the medical spa is number 1, medical grade skincare. Every influencer out there wants you to know that there's a product that costs less than medical grade that is going to get you just as good results, and they are selling it to you. And there's a reason they're selling it to you. They're selling it to you because they can't sell medical grade skincare. You have to be a provider to do so. And they are making money off of your sales. So the more they can get in your ear and tell you that this $20 cream is going to do so much more for you than the $50 cream, of course people want to believe that. So medical grade skincare, and I'll get into a little bit further, is an underrated treatment within the med spa. Chemical peels are also very underrated. Chemical peels are a wonderful way to maintain your results. You can get a gentle chemical peel every couple of months and keep your results, keep your skin fresh, and cost way less than more aggressive treatments. Or you can do aggressive chemical peels a couple of times and get wonderful results, even again at a major cost savings than some of the more aggressive treatments. IPL is also a treatment that I think is far underrated. It is a little bit more of a discomfort in that way, but it's wonderful for stimulating collagen, for brightening your skin and reducing your redness. So IPL is definitely underrated. And similar to IPL, I think the erbium laser is also underrated. An erbium laser is like a laser version of a chemical peel, and I think because of the name, and it sounds scary because it's a laser and because it's actually kind of hard to pronounce erbium, especially when you see it spelled out, that people just don't even want to talk about it because they don't know how to pronounce it, and they think it sounds scary because it's a laser. So let's dive into these a little bit further. Medical grade skincare. People will spend thousands of money on their treatments, but then they feel like they don't want to spend $200 on their medical grade skincare routine. And that's bizarre to me because every single day you have an opportunity in the morning and at night to treat your skin properly. You wash your skin every single day. Your skin ages every single day, but you only see your provider a few times a year. It's kind of like saying you're going to go to the dentist and let them brush your teeth and floss your teeth, and then you're just never going to treat your teeth until your next appointment because the dentist did such a wonderful job. You should be able to maintain that clean mouth for the entire time in between your visits, and everybody knows that doesn't happen. Your mouth gets dirty and gross and you need to brush your teeth again. Same with your skin. Your skin ages every single day, and you have 2 opportunities a day to treat your skin properly, turn back the clock, and maintain your results. The mistakes that I see people making over and over is they have been over-influenced on Instagram, TikTok, Facebook to buy products from influencers. These influencers are clearly making money off of your clicks, off of your buys, because they're saying, use my link below, click the link below. That's all giving them a little bit of money. So of course they're going to tell you that this $20 cream or $50 cream, whatever it is, that they are telling you is going to work so well. Of course they're going to tell you that this product is going to replace your Botox, replace your laser treatments, replace your chemical peels. It sounds too good to be true because it is. It's just not, a skincare product is not going to replace a facelift, and it's not going to replace a laser treatment. And on that same note, I would like to say, laser treatments are not going to replace a facelift. We say things like, 3 of these aggressive procedures is similar to a facelift, but it's never going to replace a surgical procedure. A surgical procedure can actually remove tissue or insert tissue, and I think it's better for your provider to be honest with you and tell you when surgery is or is not appropriate, when a laser treatment is or is not appropriate, and when skincare can do something for your skin or when it cannot. So small little tangent there, but honesty in your provider is huge. And I feel like the Instagram influencers, honesty is not where they're coming from. They're coming from making money off of your purchases. And that's why when you click on that link, it says things like, if you buy 5 products, you get an extra, 5 bottles of this, you get an extra 10% discount. You know why that is? Because if you only bought one, you wouldn't repurchase it, because it wouldn't do anything for you. So red flag when they're trying to sell you 6 of the same bottle. If their product was that good in the first place, you would repurchase it without that massive bundle, without buying a year's worth at a time. The other mistake I see people making is they get way too complicated with their routines, and they end up with a 10, 12-step routine that's just layers and layers and layers of product on their skin. At some point, you just can't absorb anymore. So it would be better for your skin to get a couple of products that are multitaskers and just get the job done. In skincare, you need your A, B's, and C's covered. And what that means is A is a vitamin A derivative, like a retinol, retinoid, tretinoin type product. You need something like that to stimulate cell turnover so that we get the old off and the new skin emerging. B is going to be your protectant, like your SPF, and that's going to protect your skin every day. It's not a negotiable, SPF. And C is your vitamin C, and that's an antioxidant protection for your skin. So we're going to do the vitamin C in the morning, covered by your SPF, and your retinol in the evening, and cover that up with some moisturizer. That's what you need in your routine, of course. And eye cream is wonderful. I feel like that's never in your A, B, C. Maybe we need to add an E for eye cream. But you need to put something that's gentle enough around that gentle skin on your eye that is not a vitamin C and that is not a retinol. But those are the things you actually need in your skincare routine. And there are going to be some specialty products that are important to some people for certain reasons. Like if you struggle with acne, you might need a layer in a product, something for acne. Or if you want to get into the super serums to really stimulate anti-aging with peptides or growth factors, that's something you're also going to add in there. But even if you added those things, you're still not at a 10 or 12-step routine. You're still at 4 or 5 steps maximum. I also see people that are just mishmashing products together, especially influencers doing this on TikTok. They're grabbing all these different products from different brands, and they're not meant to work together. They're certainly not meant to be cocktailed in your hand. You need to be using products that are safe to be mixed together. Some products need you to apply them, let them soak in before you even apply the next item on top of it. So I've talked about it on TikTok trends. I don't think that it is worth your money to be doing this skin flooding that people are doing on TikTok, where they're taking 6, 7, 10 products and just flooding their skin with it. You're not absorbing all of that. It's very wasteful, and it's clever. because the same people who are telling you to do this skin flooding with 10 products have links for all 10 of those products right there in the post so that you can give them money 10 times instead of one. So, key takeaway, if you had to choose between getting your Botox twice a year or doing great skincare every single day, you should be doing great skincare every single day. When you run the numbers, you would also notice that great skincare every single day, even a 4-product, high-quality, medical-grade routine, that would cost you less. High-quality skincare routine for every single day would cost you less than getting Botox twice a year. And twice a year Botox is not enough. Most people need Botox 4 times a year. So at a minimum, good skincare is necessary for sure. Number 2, most underrated procedure in the medical spa is a chemical peel. Chemical peels are overlooked because they seem either old school, like it's an old school technique, and they are, but they're still around because they work. The stuff that lasts and stands the test of time is worth it, and that's a chemical peel. So chemical peels are overlooked because they're old. Chemical peels are overlooked because they're not sexy. A laser is sexy, and saying you did some trendy laser procedure like a halo, people know what that is, and that sounds like it's far more sexy than a chemical peel. But chemical peels also sound a little bit scary. It sounds a little bit scary to put chemicals on your face. So when I opened, I was afraid of chemical peels at first too. And I said for a while, I'm not doing that. I'm not putting chemicals on people's faces. And then when I learned about it a little bit more, then I was totally comfortable with it. But on the surface, it sounds a little scary that you're going to put chemicals on somebody's face and hope the top layer falls off. But now that I understand chemical peels better and I understand the ingredients inside the chemical peels, I understand that we are putting that product on the skin to stimulate a cell turnover, to lift forward the age spots, to kill the acne, and to stimulate those younger skin cells to come forward to tighten and brighten the skin. So they're actually quite gentle, and they quietly produce beautiful results over and over as long as you keep up with them. They can be used to treat pigment, fine lines, acne scars, texture, overall brightness. They're affordable, they're effective, they're customizable, they're repeatable. You can get a gentle chemical peel every 4 weeks if you wanted to. Or you could get an aggressive chemical peel and you'd have to space that out, a bit more. But a common regimen that I recommend to my clients is let's do a gentle to maybe moderate chemical peel every 6 weeks, and we get beautiful results with that. In between, they're just doing that gentle skincare at home. We're just making sure that they are taking care of their skin barrier in between treatments, that they're wearing their SPF, and that they're getting their ABs and their Cs. So, chemical peels are incredibly affordable. When you compare the cost of a chemical peel to the cost of a laser, it's 1/3 or less the price that you're going to pay. And it's also way faster. For a laser appointment, you got to think you're coming in, you got to sit and get numb for 20 minutes, and then the procedure, and then you got to sit and cool off, and then you got to go through the aftercare instructions are just so much more in depth with a laser treatment. But with a chemical peel, you come in, you wash your face, you get your peel applied. Most of the time it doesn't sting at all. Sometimes some light like stingling where it's like a little bit of a sting, a little bit of a tingle, but it's nothing terrible. I have my patients go home and sleep in their chemical peel because we use self-neutralizing chemical peels, so it's not even complicated. You don't even have to go home and wash your face at a certain time with a certain wash or use this extra wipe. There's none of that. It's just very simple. Modern peels are just incredibly gentle and easy treatments to undergo. So minimal downtime for the most part, and you get significant improvement. Chemical peels can also be stacked, which is also something people don't think of. Like, you can get a gentle chemical peel on the same day as you get your Botox or on the same day that you get your filler. You can stack these things. You could get a laser treatment and put a gentle chemical peel on top of it to get even more out of your treatment. So it's something that you can do alone as a standalone service, or you can do it as a stacked service so that you get even more out of that procedure. And we do one where we call it a hybrid chemical peel, where you start the chemical peel with a facial. You have this nice relaxing facial, and once your face is completely cleansed, instead of applying a thick mask and having the thick mask sit on your face, we apply the chemical peel. So you get this nice, relaxing, gentle service that gives you powerful results at the end. And that's something, again, we call it a hybrid chemical peel. I'm sure other places call it their own, but the reason we call it that is because you get to enjoy that facial as well as the chemical peel. And then the last two that I have on my underrated list are both kind of laser treatments. IPL is not truly a laser. It's intense pulse light. Another brand of very similar technology is called BBL, or broadband light. And what these are doing is we are targeting brown spots, sun damage, redness, rosacea, broken capillaries. This treatment is just overlooked, I think, because people don't know what IPL or BBL is. They often assume that it's a laser. It's very similar to a laser, but it is a light-based treatment. It's something that plumps the skin because it does stimulate some collagen. That light penetrates quite deeply into the skin and stimulates collagen. It's going to help with acne, so the skin is going to clear up afterwards. The makeup is going to go on better. They'll have less redness, and your skin complexion or skin tone gets more even. You don't require as much makeup. It's not a resurfacing treatment, so sometimes we will combine an IPL with something resurfacing. What I like to do is a chemical peel and on top of the IPL treatment, because the IPL is so great for redness and rosacea, broken capillaries. And then if you put a gentle chemical peel on top of it, you're not introducing any more heat. So we're not going to stimulate any further redness or irritation. It's turns out to be a very gentle treatment that overall really takes care of skin tone, and really can give you that glassy skin that you're looking for. It's also not something that you have to come in and get numb for. Your face doesn't leave bloody like with some microneedling treatments. It's just a very quick, and it is invasive, but it's not invasive at the same time because you don't have to be numb and there's no needles. It's actually a pretty pleasant treatment because the pain that occurs a little bit with each pulse of light is immediately gone the second the pulse is over. So you don't have to sit in the chair and cool off after. It's just gone as soon as the treatment is over. And we use something called a chiller, which is almost like a personal air conditioner. It's like a little fan, but it's incredibly cold air that you can hold, or someone else can hold for you, and point it at your face while you're having the treatment done. It both distracts you and takes away from the little pulse of light that is a little bit uncomfortable otherwise. The last one that I wanted to talk about was erbium laser. And the reason that I feel that erbium lasers are undervalued is because when you say laser, you automatically assume that it's going to be a very aggressive treatment and that you're going to have a lot of downtime. Now, there are tons of levels of doing an erbium treatment, but the erbium is targeting water, and what that means is it is a resurfacing treatment. It's targeting the water in the cells on the top layer of your skin. So if you have on the top layer of skin fine lines, wrinkles, dark spots, those are the things that we are going to be targeting with the erbium laser. And this treatment is, again, a gentle one. It doesn't have to be you don't have to be numbed for. On a more aggressive treatment, you would want to be numb for that. But on a gentle erbium treatment, you don't have to be numb for it. You come in, we wash your face, get your face super dry with a final cleanse that has some sort of alcohol base in it so that all of the oil and water is off of your skin, and then the treatment is not terribly uncomfortable. You leave a little bit warm. Your face will be a little bit flushed and red that evening, and then usually calms down by the next day. You just feel a little bit gritty. And over the next couple of days, you'll have a little bit of dryness or flaking as that dead skin falls off and the new skin begins to emerge. These treatments are called fractional, which means that only part of the laser is working on your skin. 35% of the laser is powered, 65% is off. So that means 65% of the treated area is healthy skin that's poking through and helping guide the new skin out. So this is going to be a very similar treatment to having a little bit more of an aggressive chemical peel done. Some people will call an erbium laser a laser peel because it's achieving the same goals through a different mechanism of action. The laser treatments are not super painful. Like I said, it mostly just feels like a sunburn. It's pretty low risk. Having said that, we've screened you properly and prepped your skin properly. It's a pretty low risk procedure and it's pretty easy to recover from. You could easily have this treatment done on a Friday and go to work on Monday and nobody would know. You could even have the treatment on a Monday and go to work in some environments on a Tuesday with some light tinted sunscreen on top and nobody would know. The only people that are going to know is people who get super close to your face, like your family, might notice that your skin is a little bit textured or gritty while that's starting to fall. Those little areas are starting to kind of flake off and peel off. When we do any of these treatments, IPL, chemical peels, erbium, when we do any of these treatments in our medical spa, we provide our patients with home care, which means medical grade skincare that goes home with you, appropriate for post-care after these procedures. And the reason we do that is because the first item I talked about is you need the proper skincare every single day. You get 2 opportunities to put the right things on your face, treat your face, your skin properly twice a day as a home treatment. And so we call these products that we send you home with home care because it is the care for your skin that you will be continuing from home every single day. And then we give our clients recommendations on what they should be using at home and a discount that day to help them with that, because we understand that you came in expecting to spend X amount of dollars on your treatment, and now we're recommending the proper home care to you, and that might be a little bit more money than you were intending on spending that day. So we pass along a discount to you if you want to buy the products right now. If you don't want to buy them right now, use the small size that I gave you today until this runs out. And then I'd love to see you back because I want to see you take care of your skin every single day at home so that you can maintain your results, have less treatments, save money, and be happy with the investment that you made in the service and in the home care that you're taking home with you. I want to see happy clients. So that's my thoughts on the 4 most underrated procedures that are done in medical spas. And I hope that you take away from this that you don't have to only get Botox and filler to get the results that you want. There are other ways to get them done, and that you're taking care of your skin at home every day. See you next time.